Okay, in summertime, this is a big concern for a lot of pet owners out there. What happens if your dog or your cat gets bitten by a snake? Dr. Jerome Williams from Red Mountain Animal Clinic is a regular here, but he's brought along Dr. Brant Tolbert from the Emergency and Specialty Animal Medical Center. Gentlemen, thanks for joining us.
Good morning.
And tell us who this is.
Oh, this is Sally.
Hey, Sally. Isn't she a beautiful dog? So tell me, Dr. Williams, somebody comes in and they don't know what the problem is, and then you find out it's a snake bite.
Snake bite, yeah, then we began to treat aggressively, but oftentimes it's in the evening and it's during a time of day that we're closed. So snake bites need to be treated as quickly as possible. Immediately, yes. So in those cases, we send them to the Emergency Animal Clinic on Acton Road, where Dr. Tolbert will see them during the evening hours or the weekend hours.
So then what happens once they get to you?
Well, the biggest thing we usually fight with snake bites is the snake bite venom is designed to drop blood pressure.
Wow.
So we give a lot of fluids, and sometimes they need antivenin. Biggest thing is if it happens when you're at home, don't put a tourniquet on, because usually it's on the foot. Don't put a tourniquet on the leg. Don't make a cut and try to suck the poison out. The best thing is to get them to a veterinarian.
Okay, so help us out here. What do we look for? How do we know it's a snake bite? You might not have seen the snake bite the dog, so how do you know it's a snake bite?
And most of the time you actually don't see the snake.
Right.
Most of the time it's a history of they were outside. It's usually this time of year. And the two things you'll see is swelling and pain in the area. Sometimes you can spot one or two puncture wounds, but not always. But swelling and pain is the biggest two things.
Okay, we've got some pictures, and you can help us identify what's going on here.
This one was actually bitten in the face. And things there, usually it's either the foot or I kind of talk about if they don't see the snake, it's the foot, and if they do, they're investigating and they go, hey, what's that? And the snake gets them in the nose or the head. So,
oh, there, what's that?
That looks like a lot of times what we'll see is
look
those.
at the cat.
We'll actually see the history of someone to go outside and see their foot, the dog's foot, with a lot of swelling, pain, and they'll find a dead snake where there was an argument between the two.
Oh, and the snake is
and
lost.
that's some evidence where there's been a snake bite. You see that.
Yeah,
so.
the puncture holes. You can see it really clearly in that one picture. And what about this dog? Was it in the face again?
Yeah, these are all in the face with the swelling.
The face
And that's
of the feet. Those are the usual areas.
And sometimes the swelling is dramatic, like
Yeah.
you saw on those.
Definitely. So what's the treatment, first of all? You talked about the low blood pressure, and then what do you treat them with?
Usually IV fluids, pain medicine, antibiotics, and then if they need antivenin, the antivenin.
And we talked about how important it is to get to you immediately. Give me a time frame. How much time does a person have to get their dog to you to save them?
They can get very sick within about 30 minutes,
Wow.
or sometimes even faster. There can be some delay, but as soon as you see that swelling or in pain, or if you see the snake dead or otherwise, as soon as you can.
Yeah, okay.
Antivenom can be used, but it's very costly. So many times we elect not to go with it because of the tremendous cost of the antivenom.
Okay, so gentlemen, thank you so much for joining us. Hopefully we save a lot of pets out there. And Sally, has Sally been bitten by it?
No, Sally had parvo when she was a puppy. We were to save her.
wow.
See, she's not. Stay away from the snakes, okay?
Okay,
We don't need to do that.
Please, Sally.